go.
And then comments will be on the right.
All right, we're just waiting for some more people to get in here, right?
Yeah. Or you can start.
Okay.
I'm close to the water.
Well, I guess we could introduce myself. I'm not sure if any viewers are here, but we could always share this video and send a link to people that wasn't participating. But I'm going to introduce myself. My name is Tiffany. I'm Mexico Cosmetic Coordinator. I'm also a past bariatric patient of MBC. I got my surgery from 5 years ago, so I lost over 100 pounds. So now I work for the cosmetic department, and I'm going to leave it over to Lisa.
Hi, I'm Lisa. I'm one of the other Mexico Cosmetic Center coordinators on the cosmetic side. I'm newer. I've been here a couple of months, and my background, I was a nurse for over 23 years, and I love being here now and being able to help everybody look and feel their best.
Yes.
Yes.
So we're going to look at we have some questions. I see we have a viewer. We have some questions here that frequently asked questions, and I'm going to let Lisa start off with this question.
Okay.
Go ahead.
So why choose Mexico over the U.S.? Well, a number of reasons. Number one, Mexico is number one in cosmetic procedure surgeries. It is the top area for all procedures. There are numerous locations here in the U.S., but as we do it every day, 6 days a week. Our surgeons are having 2 to 3 surgeries a day. They are very well versed in cosmetics, and they specialize in bariatrics and mommy makeovers. So why choose us? Number one, it's safe. Number two, the price effective. Number 3, you're getting the top surgeons who they know the newest procedures. They've been doing this every day, so they know how to fix different things that other people might not know how to do, or procedures. They are at the top of their game in Mexico. They are very advanced in the cosmetics, so that's why you choose us.
Okay. So the next question somebody asks is, do the hospital's rooms have English, Spanish-speaking TV, Netflix, and or Wi-Fi for my recovery? So they do have, you can bring your own, like your Fire Stick. They do have Wi-Fi, so you are able to get in contact. Well, you are able to use your Netflix when you're there.
All right.
So,
and I'll take this next one. How does MCC differ from other cosmetic centers in Mexico? Number one, we are a U.S.-based company. So we are located in our corporate office in Northern California. And so what that means is because we are U.S.-based, we do follow the protocols of both Mexico and the U.S. So you're getting English-speaking staff. We are always available. You are going to be able to reach out to us if there was ever any kind of assistance that you need. We follow through. We're not just going to be like a turn and burn type of facility. We care, we follow up, we make sure all your questions are answered. While you're there, we're checking on you. We're reaching out to our hospital coordinator that we have very personal relationships with them. We're messaging the doctor. So, just that's the difference between us is you're going to get, it's not only all inclusive, you're going to get we're going to treat you as a whole person. And like I said, the biggest thing is we're US based. So we follow both protocols, and that's a big thing, a very, very big thing in cosmetics. You want to be able to feel secure with who you're coming to enhance your body.
Yeah, and we do have a comment. We could go there really quick. Some comments, if you don't answer, because we're going to answer the questions here, but if we see them, we'll stop and answer those. But the ones that we don't, at the end, we'll answer them. But I see Lynell, Marie, what about all the follow-up after surgery? So as a coordinator, we do reach out to you and check on you. You'll get emails. But if you have any problems, like with questions after, and you haven't heard from us, reach out to your coordinator. We will reach out to the surgeon. We will also get a number from our aftercare nurse via WhatsApp, and you can also message her there. And if you don't hear from her, because she is busy too, she is also a nurse at the hospital, so if you don't hear from her, reach out to us, and we'll make sure that your questions are answered, and yeah, pretty much that. So
And the second part of that is the medical tourism insurance.
Yes.
Covers you for 45 days post-op. So, for example, I just had, somebody this week that there was, during surgery, she had not a complication, but just, something arose. And we took care of it, and I let her know today, hey, you can submit that to Mexico Cosmetic Center, or to the medical tourism insurance, and they're going to cover that for you because it was a complication during surgery. So that's super important. We're not just leaving you there hanging. If you have questions about swelling, if you have questions about when the sutures are going to come off, which we frequently get, anything like that about, or asking the surgeon a question about, well, should I be healed at this point? We're as your coordinators to be able to reach out to them almost 7 days a week. And so we'll get those answers for you.
Okay. And so will U.S. Customs have any issue with bringing my recovery medication back across the border? So you know the answer, right?
Yes. So because we are we're bringing you across on a medical transport with the medical fast pass. So you're not going into Mexico through air or sea. We're asking you to arrive in the San Diego airport, and then we're taking you across the border. So as long as they obviously know we go across the border frequently, 2-3 times a day, 7 days a week. They know who we are. And with that fast pass, as long as you keep it in the container and you have it marked, and you're going to have a prescription from us in the aftercare, you're going to be totally fine.
So is the price you quote all-inclusive? Yes, it is. So with all-inclusive, you get your hotel, your transportation from and to Tijuana from San Diego to Tijuana, the hospital stay, the medication that's in the package is included. Your medical tourism insurance, we are including that now. Your anesthesiologist is included. Your garments, your first garments are included. So it's pretty all-inclusive. Of course, there's always airfare that we don't cover. If you're bringing a companion, that's not included. If you need any medication that's outside of your package, of course, that is extra. Of course, your coordinator will let you know what's extra that's not in your package. But for overall, everything you need will be in that package. If you want anything extra, of course, you can pay for that.
And our prices for the companion is $390. So that's basically most procedures are a minimum of like 5 days. So think about that. You're bringing someone along for a 5-day vacation in Mexico. Pretty cool. And they get the hotel, they get the transport also, and then it's a very touristy area where we're located. So there's lots of restaurants they can visit. We have a spa inside our hospital, Spa Flora, that does anything from fillers. We do stem cells, which are amazing. Everything you can imagine there. And so your companion for $390 gets to go and have a great time, and then they can take advantage of our spa while they're there.
Yeah. And also, is the fat transfer permanent? I like the way you answer this.
You like this?
Yeah, because we've been talking about it, and she sounds good saying it.
So we frequently get asked this, and the reason is, some people don't like the look of implants, but you have to think about there's so many different versions of implants. Of course, there's silicone, there's saline, there's high profile, there's Motiva, there's gummy bear. So what the look that you're looking for, you're going to get. But with fat transfers, unfortunately, we can only take a certain amount of fat and transfer it at one time, which according to our surgeons, and this is per our surgeon, 250 cc's, and it does require multiple visits. So let's say you're somebody who is a past bariatric patient. You've lost a lot of weight. You have a lot of you're deflated in there. You don't have a lot of volume there. Doing one fat transfer, you're not going to get the result that you want. So that's why we recommend always, you're going to talk to the surgeon. You talk to them about what you're most interested in, what you're most concerned about. Implants are just a great option. And it's just something that it's not money-wise. It's not something you're going to have to do 2 or 3 procedures. So we just would always recommend. I'm not saying that we won't do it, because we will, but you just have to know and be realistic about the outcome that you're going to get.
Yes. And so fat transfer could be anything. We do like the BBL, so that's fat transfer. We do fat transfer to the face. So it's the same in that sense. So like when you're getting your BBL, not all the fat is going to survive. So yeah, it's not permanent, especially if you are a bariatric patient and you lose weight, or even if you lose weight, your fat is going to dissolve as you lose weight. So it's not, we'll say it's not permanent.
And the other thing I forgot to mention, you do only retain about 50% of whatever they put in. So you've got to, you're going to, your body's going to reabsorb that. So you've got to take that into account also.
And I see Teresa. Hi, Teresa. I just see a question. We just talked about this. The compression garments are supplied. And yes, I do recommend you purchasing an extra one. Just something that you could change into as you're washing the other one, so you can have one on. So you should purchase an extra one, but you do get one after your surgery.
Yes.
Tiffany, you want to mention also they could go online.
Oh yeah, so we do have a company that we use. If you don't purchase at the hospital, Contour MD, you'll get 30% off using the code MCC30. I'll put that link in the comment section so you guys can look it over. And if you already had surgery, you can also purchase it's not just garments. They got lipo pads, they have BBL pillows there. So yeah, we'll send that link in the comment section and with the promo code to get 30% off.
But remember, especially if you're having like a tummy tuck and lipo, you're going to go down cc's. It depends on how much fat they're going to remove. So you kind of want to wait till you get there to see what you're fitted into by our nursing staff, and then go from there, purchasing another one. And you can always purchase at the hospital also.
Okay. And what else do we have? You guys could put comment questions in there too. We'll read them at the end if we can't get into them now. So we have, will I need more? Okay, we already discussed that. Will I need more than one session for fat transfer?
Yes.
I think we would answer that. And we get, okay. Ooh, this one's hard because floor is right here. What is the maximum? What is the maximum BMI you allow for a tummy tuck? It's kind of like a gray area to me. So we have patients that had a BMI of 34, but they were a bariatric patient, and a lot of their weight was in the skin. So if you're like have a lot of more loose skin, we can take your BMI a little higher, but we do recommend getting as low as 31, just for better results. I understand that people they have that loose skin and they kind of want to get rid of it right away, but you got to remember you're still losing weight, so you will probably end up having to come back if you don't get it at a healthier BMI. And it's also like a higher risk when your BMI is higher. So if you have a 40 BMI, you want a tummy tuck, more than likely you'll get denied, but we'll also look into other options for you. Like we have, you have the MBC bariatric side if you want to go that route in order to, go with the cosmetic route.
And pretty soon, super exciting to say this, we will be offering GLPs. So that's going to be an amazing addition to the cosmetic side and the bariatric side.
Okay, what happens if I get pregnant after a tummy tuck? So I think it's more genetic. So I've had people that got a tummy tuck and they had their baby after, and their incisions still look fine. But you have to understand that your muscle repair can open back up, and also it can also jeopardize your tummy tuck. So we highly recommend, if you're going to get a tummy tuck, that you are done having kids. We can't control that, but if you want to get a tummy tuck and don't want to mess it up, just make sure that you are, you no longer want the kids after. But that's pretty much it, right? Yeah.
I'm going to take this one. What can I do to make the results of my facelift last longer? We get asked that a lot. Our surgeons are amazing. They do, part of our deep plane facelift does include stem cells to the face. And if you haven't heard about stem cells are, it's newer here in the U.S., but Mexico's been practicing and utilizing stem cells in the late 70s. So they're ahead of the game. We can offer anywhere from like 1 to 3 million stem cells in one treatment. So including in our deep plane facelift, like I said, is the stem cells to the face. What that does is gives you a refreshed look. It gives you a longer lasting effect, a more youthful appearance. And stem cells, what they do, they kind of add, it's like a little beacon in your body. When you put the stem cells in your body, it goes to the area that needs to be repaired. So when you do that, and if you do the extra treatment, which I highly recommend for everybody doing, especially a facelift, or even a tummy tuck, because there's a lot of healing that goes along with it, I would recommend doing the IV or injection stem cell treatment while there, because it's going to help with your scarring, it's going to help with your recovery, it's going to help with your inflammation. It helps with everything. So you're going to get a longer lasting effect. Stay out of the sun, cover, follow the directions of our aftercare. Make sure that you are wearing sunscreen after, and smoking is a big thing. Smoking, and this is for all surgeries. We get asked this frequently when we have people, and they're like, well, do I have to stop smoking? We highly recommend, we do ask you to stop smoking at least 2 to 4 weeks before surgery. What smoking does is it constricts your blood vessels. And what that does is the blood, because they're constricted, they're not going to go to the areas that need to be repaired. So when you have an incision, for example, on your tummy or your breast, or if you have torsoplasty or the facelift, you want all the blood circulating there. So that's why it's super important to stop or limit your smoking, and then do all the other things, arnica gel, vitamin E, and we give you all that information in our aftercare.
Yes. So will this address my will this address my neck lift as well? Or do I need a separate neck lift?
Remember we were talking about this one.
So a lot of people that they come in, I just want a facelift, I don't want to address my neck. So when it comes to your face, when you adjust one part of your face, it's going to change the other part. So we always recommend getting the neck and the mid face at least. Some of the surgeons, they will just do a neck lift, but we always highly recommend doing the mid face, because we change one thing, the other part of your face change. You have a more square face, and then you pull this in, it kind of just blends all together. So our surgeons,
age as well too.
Yeah.
Age is important.
Age is
very important.
But what do you have to add? Something to add to that?
No, just I kind of explain it it's like fitting a broken puzzle piece.
Oh, yeah.
So when you adjust something here and you pull up, this is the way one of the surgeons explained it to us, was then you're going to be left with that excess. It's going to be an irregular piece. And so you if you're going to do the face, if you're really considering it, there's certain things you can leave off. Like I told Tiffany she could use me as an example today. So explain a full deep plane facelift and what we do. Come on.
So the deep plane facelift is, I know this word deeper in the muscle, but I can't explain it. You told me. Come on, Flora.
It's on, I don't want to
No, we can't.
It's more like going up.
It's more going up.
It's under the muscle.
It's under the muscle, yeah. Deep plane is under the muscle.
That is important. When you lift this skin up, you have all this extra on the side. So it has to be. Every time you do facelift, you don't do just a mini facelift. Facelift is considered neck and
yeah. And it lasts longer. I feel like the deep plane lasts a lot longer.
And you get that fresh look.
You get the fresh look. And it's not that cool. A lot of people think with facelift, especially the surgeons that we use, they make it more natural. Like if you just look about like you got a good amount of sleep and you maybe like 15 to 20 years younger. I've seen some patients, they look like the younger version of themselves, but it doesn't look fake. That look that people are trying to go for. It's like pulled back, and you can tell that they got it done. So that's one thing. We don't do that.
We don't do the ponytail facelift.
Yeah.
I've been asked that recently. We don't do that, or we don't do a mini facelift. It's just not recommended. But with the facelift, the full deep plane from us, you're going to get something called the canthoplasty, which is basically the outer lifting of the corner of your eyes. So if you have that hooded look, it actually can improve your vision also, but it just gives you that more refreshed, wide awake, youthful look. So that gets addressed. We do a lip lift. We do fat transfer to your jaw, to your mid jaw if needed. It's going to address your forehead, your mid face, your neck lift. We do the upper and lower eyelids, and then we do the stem cells to the face. So all of that is included in a deep plane facelift, and you're going to get the best results if you do it all together.
Sometimes patients say, I don't want to add any fat. but
Yes.
they must
Yeah.
because it's a fact that they give that smoother skin.
Yeah.
And also, it's not that they're really going to add the fat. It's just to get a evenly look.
Yeah.
Some area is hollow. They have
Hollow.
to, yes, they have to add fat to smooth it up.
Absolutely. Like when we age and we start getting that hollow cheekbone. So
On
that's,
the side
yes. And here also.
Yes.
Yes.
So I think
here. Or
that might be-
even on the top, we get hollow. They
Yeah.
add fat a little bit.
So is there any other questions? If anybody have any questions that you want to post, if we end this live, you can always send some comments or reach out to one of if you have a coordinator, just reach out to us, or Sarita's on here. If on a Facebook group, you can always put questions on the Facebook, and she will always relay those messages to us. But I mean, if because I know we could send this video later, and I know I'm sure there's a lot more questions that needs to be answered. Is there anything that you want to share?
As you said, if they ever have a question, reach out to you too, and you, Tiffany and Lisa, anytime. And they could also reach out to me, which is Flora. I have my phone 24/7.
Yeah.
She's our after call. So on
Yes.
weekends, you'll always get
You'll
Flora.
hear from Flora.
And you see me a lot in Tijuana.
You will see her. If you haven't surgery, you may see her there. Oh, I do have I know a question a lot of people ask us, I'm surprised that's on there, the thigh lift and the tummy tuck
Oh,
being done
yes.
together.
Yes.
We get this question asked all the time. Can I get a tummy tuck with the thigh lift? Some places will do it, but with us, the thigh lift is like one of the hardest procedures to recover because you're constantly walking around. So we want you to focus more on the recovery for your thigh lift. And the decisions for the tummy tuck and the thigh lift are really close together. So we highly recommend getting the thigh lift on its own on the second round. We try not to do a lot of the upper and lower bodies done together just for mobility, like your arms and your thighs. Sometimes we'll do it just depending on your health and what the surgeon feels like we can do, like if your BMI is in a good range. But for the most part, if you're sending your health questionnaire and you're wondering why you didn't add the thigh lift with the tummy tuck, that is the reason why it's not added. But we can address that in another round.
Well, one thing I want to add is our thigh, usually the skin is pretty thin.
Yes.
Okay, and the healing, that means you have to be super careful to heal. And also when we get older, our skin gets thinner.
Yeah.
So
Yeah.
those are all very important. That's why
Yeah.
most of the time the doctor don't recommend.
They don't recommend it. And also that's like the area where you could get the most bacteria. And you have to clean that area. And then now you got to worry about your
Yeah.
tummy tuck and
And
your
we-
arms and your
Yep.
breasts.
And we want you
So,
focusing on one.
yes.
And also, too, being under an anesthetic for such a long time, we limit, we have our surgeons do 2 surgeries a day because we want them well rested. I mean, you want your surgeon well rested, right? So we do that, and that's part of it too. Is like we don't want you under anesthetic for 10 to 12 hours. We limit how much time you can be under. So, and that's a pretty extensive surgery.
Yes.
What about the passport?
Oh, okay. So, as far as the passport, we highly recommend you getting your passport. Obviously, some people are trying to come out there tomorrow. So, from what our drivers told us, you can have your real ID with your birth certificate. But if you have a lot of time, I think you should might as well just go get your passport. Just kind of make an easy process with traveling in general. I'm pretty sure after your surgery, you want to go somewhere tropical. So you might as well just go ahead and go get your passports. But it's not a requirement, but it's highly recommended.
What about the muscle repair? We frequently get asked that one with the muscle repair. Everyone will ask, is the muscle repair included in the tummy tuck? Of course it is. It's part of the tummy tuck. When they're removing the skin, they are fixing the underlying muscles. So it is included when you see, and there are numerous tummy tucks. A lot of people think there's just one version. There's a fleur-de-lis, there's circumferential, there's just a regular, a standard tummy tuck. And the incisions are going to be different. So we have a graph where we can send you, we can show you where the incisions are going to be. but our surgeons will always recommend the best to remove the optimum skin and fat from the area.
Yeah, I know a lot of people like that. They don't want that, the fleur-de-lis, they don't want that incision that's going down, the vertical incision. But if the surgeon recommends it, I highly recommend like going with that route, because he's saying it for a reason. You have a lot of fat on your upper stomach, and also does help pull everything in. I mean, it's like a corset, like, you know, just shoot. That's what it does. And also it helps with the back a little bit. So I know a lot of people are scared about the scars. If you follow the post-op care for the scarring, I've seen a lot of people that get tattoos. So like there's like, I would have no problem having a vertical scar if I'm getting like the real full results. Because we have patients that didn't follow the, you know, what the recommendations that the last surgeon said, and they come back to us and we have to fix it because they didn't listen to the surgeon. Like we recommend that. So they end up getting it later, but if the surgeon recommends it, I will go with it. Obviously we'll do the circular, or just extend it, but for better results, I would just highly go with the surgeon recommends.
Yes. If the surgeon recommended, please listen to the surgeon.
Yeah, please
because
listen to the
they know the
surgeon.
best.
Yeah, and if you have questions, we will go back to with the surgeon. We communicate with the surgeons all the time,
Yes.
and that's another thing about the consultation. Video consultations. So I'll let you, because I know you don't like.
So if you go in the U.S., you're most likely 90% of the time going to also meet with a coordinator face to face. The doctor is going to come in there, take a quick look at you, give the recommendations, and then you're going to speak with a coordinator the rest of the time. We act as a liaison for our surgeons, and like I said before, we're in constant contact all day, every day, on numerous chats with all of our surgeons, asking questions. Is this possible? Why can't you do this procedure? So we're your eyes and your ears. So that's why it's super important when you fill out that health questionnaire. Give us all the information. Ask all the questions then, because then that's what we do. You're going to meet your surgeon that day, and you're going to be able to talk to them. But we basically act as your free consultation. So that's what we're here for. Ask all the questions. Ask just whatever you have. We'll be able to get the answers for you. And just remember, we are getting them directly from the surgeons.
Yes. So yeah, if you need a video consultation, I would suggest ask your questions with us first, because we may be able to answer it. And then if need be, if it's like a guarantee, like, oh, I need to see the surgeon, we could arrange that, but it takes a lot of time. Our surgeons are constantly doing surgery. They're in seminars doing everything they need to do. So we don't want to take their time doing video consultations if it's not necessary, because we can answer those questions. We can relay messages to them and get your answers for you.
Something new that we are offering on our website and actually at our location, I had mentioned it earlier, is the stem cells. Mesenchymal stem cells are what we utilize. It is an awesome, amazing advancement that, like I said, has been coming now to the U.S., but Mexico's been doing it for a long time. We have an awesome doctor, Dr. Raquel Martin, who, if you know her, we can get you 15-minute consultations to talk directly about what it is that you want to utilize the stem cells for. And they utilize stem cells for post-recovery, for stroke, for early dementia, Parkinson's, pain, inflammation, you name it. Like I said earlier, and I'm going to remind you again, if you're doing any kind of extensive surgery with us, I highly recommend asking about the add-on package of the stem cells, because it's going to help with the recovery. And if you are over the age of 50, like me, you're going to be slower to recover. So you want to be able to get that. And the cost is amazing. You'd be able to get either an IV or an injection, and it's going to help you with keloiding, with any kind of scarring. It's going to you're gonna feel amazing. So, and the results differ for everybody based on what you're utilizing them for. But we have the best out there.
So Lisa also mentioned about the
The hyperbaric
hyperbaric chamber.
Yes.
You know about it more.
Okay, so
Nurse back
It's
here.
amazing.
so the hyperbaric chamber sessions, most of you that are probably on here and you've scheduled surgeries, you have received a free session and you're going to get to experience that. It is amazing. It's anywhere from 45 to 90 minutes and you're in a chamber and it's basically letting pure oxygen in there. It's going to help in your recovery. It's going to help with pain. It's going to help with inflammation. It gets basically into the underlying layers, your tissues, and your like adipose tissue, and it circulates in there, and then you're breathing that in, and it's recirculating, and it's just helping you basically heal from the inside out. And then you're just going to feel better. It's like,
so much better than I would have.
it's like 90 minutes of heaven in a
Yeah.
chamber. Now, I will have to warn, if you have an issue with like being closed in, claustrophobic, let us know, because if you do purchase those or you do have it as part of your session, we can possibly get it to where there are open chambers, but we have to make sure that we have those available.
Yes, that one is a little bit harder. Also, do mention it that you have to get it done 24 hours
Yes,
before.
before. So yeah, if you're getting the hyperbaric chamber, you have to wait. Is it before?
Before they fly home.
Oh, before you fly home, and I think it's 24 hours after your procedure too, because you want to make sure you're all good
Yes,
before you
yes.
go. I do see we missed one question.
Somebody
Is
asked too.
that's Sarita. She's helping us out so they can get more information. Can you bring a companion, and what are the rules for them? So I think you did kind of mention that. Yes, you can bring a companion. The companion fee is $390, what Lisa mentioned before, and the rules are they'll be at the hotel. We do have visiting hours 7 a.m. to 7 p.m.
At the hospital.
at the hospital, so your companion can come visit you, and then they'll go back to their hotel. As far as we do allow, it's up to you for your companion to stay at the hospital with you, but they are limited to a reclining chair. And what else? And also, we also have bariatric patients there. Sometimes, like bringing food in there could be a little hard. So I always recommend that the companion stays at the hotel. It's not far. It's walking distance.
Actually, walking
It's walking distance.
And they get free breakfast.
They get free breakfast.
And the breakfast is amazing. It's really good.
Yeah.
And it's more comfortable for companion.
Yeah.
Absolutely.
Than stuck in a hospital.
And they're only going to be there for 2 nights, and then they're going to come and join you at the hotel.
Yes.
And also you get their daily nurse there, so
Yeah.
you'll be good.
And then remember, you're recovering from surgery, from major surgery. You're going to be
Yes.
wanting to sleep. Sleep
Yes,
is going to
you
be your
wanna be
friend
left
for
alone.
recovering. You just want to be kind of, left alone. And the area is a very touristy area, the real area where we're located. There's restaurants around there. There's a museum. There's a golf course. I'm not saying that they should go leave you and go have fun while you're recovering, but you kind of want them to kind of explore and then come and visit you and just check in on you. They're gonna have a better you're gonna have a better recovery. Just having them stay.
At the hotel there is a gym. They could go work out.
Yeah.
It's just.
Is that it? So anybody have? I think we got 3 viewers.
Yay.
But we're gonna send this video. I'm sure we're gonna put this out so that we can share this with other people. So if you have any questions, even after the video, you can put it in this comment section. Like I said, communicate with your coordinator. Sarita is a good resource too. Like if we're not hearing over the weekends and you're not getting phone calls or you're not getting a reply back to you, you can always message Sarita or put it, and she will definitely let somebody know especially if it's an emergency. And also when we get back on a Monday, if it's a weekend, we'll get back in contact with you. So Sarita's really good at doing that. So that's a good resource.
Tell them that also they can message me.
And they can also message Flora.
And
Yeah.
the phone
And
number.
we'll put her phone number, there. So we'll put her phone number there.
One other thing I wanted to mention about when we were talking about the difference between MCC and now that we mentioned the hotel. The difference between us and other companies that are there in Mexico, most of them utilize residential recovery homes. With us, the reason we choose to do the hotel, number one, it's more secure. It's not in a residential area in Tijuana where you're gonna be in a neighborhood where you're not sure and coming in and out, especially if you bring a companion. So it's more secure while you're in a hotel. You have a front desk. It is locked. There is a lobby.
Security is stand outside
Yes.
24/7.
There's security in
You
Mexico.
got a
If you have-
key to get in and get out.
and yep, and if you're
that's
coming,
very important.
very important.
Even
yes.
though our area is extremely safe and comfortable.
Very safe, yes.
But
Yes,
that's
they're very
perfect
safe.
point that you brought up.
Yes.
As far as the hotel, yes.
And another difference that I noticed is a lot of people are like, "What about Miami?" And I have friends and friends that have gone to Miami and got their surgery. Oh, it's $3,000 cheaper. Just to let you know, majority of them are clinics. They're not going to keep you overnight. As soon as you wake up, they're wheeling you off into Uber. And you also have to pay for your own hotel, recovery home. So
Even in the
that's
US,
just something that we look
yeah.
into. That's why we keep
Yeah.
you guys 2 nights. We observe you and make sure you're good before you even go to the hotel for recovery. So that is one of the biggest difference that I noticed from the U.S. and with at least our company, MCC, is the difference. Especially if a lot of people, Miami is cheaper. Yeah, because we offer you more. If you're safe, we make sure that you're in contact with your coordinator. I know a lot of people have a hard time, like, after I have surgery, I can't even get in contact with anybody, and it took them 3 weeks to even get me a quote. So we're really quick to respond. If we are not, that means we're not in the office, or we are probably out for the day. So we're always available to, answer any questions that you might have. And I think that's the difference that I noticed in the U.S.
And we are a U.S. company.
And we are a U.S. company.
That's the most
Yes,
important
in Mexico. So we
Yes.
follow the guidelines of the U.S. in Mexico. So that's really a lot of places, even in Tijuana, is not like that. So that's what makes us a difference.
Yeah.
And I think you mentioned that. So
Yeah, that's the one of the biggest differences. And also, talking about like the outpatient, even in the U.S., anywhere in the U.S., if you do any kind of surgery, they're now 98% all outpatient. So that's a big thing for us. You're gonna, the hospital is beautiful. I don't know if you guys have went on to the video. I highly recommend looking at the video, looking at our surgeons, looking at our staff. And everything that we have to offer, but the hospital is beautiful. You're going to have a panoramic view of Tijuana. It's clean, the newest equipment. You're going to have a beautiful, area to recover. So that's a huge thing, because at the end of the day, getting back to about the price, cheaper doesn't equal better. You want to go to surgeons who are highly sought after. Our surgeons are highly sought after. They're very well known for what they do. They do this every day, 6 days a week. Mm-hmm. It's kind of like, it's a specialty. So like if you go to like a nurse who works in the ER and a nurse that works in an OB, they're both nurses, but they do different specialties. Mm-hmm. That's the difference with our surgeons. They do this 6 days a week, so they know what they're doing, and their results are amazing. So cheaper doesn't necessarily mean better. Yes. So if you go, you will be ending up coming back to us to do some revisions, because we have many of those also.
And always ask what's in their package, because just because they say it's $3,000 more, you're going to pay for hotel, you're going to pay for your garment, even the medication, anesthesia, and that's why I don't know why they do that, because it's needed. So that's why we put everything in one package. So if you are comparing other places, just make sure you get all the information from us so you know what you're getting, and then you could always go back to that company and be like, oh, okay, that's what they were talking about. So just make sure if we reach out to you and you see a price and you're like, what is that? Just give us time to explain to you, so that way if you are going to go somewhere, you can have all the information you need.
Yes, because you want to do your research. Your body is, it's your body. You can't change. You want to change it for the positive and get the best outcome, and get somebody who's highly an expert in it.
Okay. Well, I think that might be it. So if anybody has any questions, you can always put in the comment section, and also reach out to your coordinator if you haven't filled out a health questionnaire yet. If you haven't filled out a health questionnaire, just fill that out, and one of me or Lisa will be reaching out to you. It's very important that you start that process, just so we get you a quote and get you the recommendations from the surgeon. It is free to do. The consultation is free. So it takes a little bit of your time, and we'll be there to help you.
And right now we have a Memorial Day special, so you can get anywhere from $250 to $1,000 off your procedures. So I highly recommend you book those procedures because our prices do vary. Of course, like everything, is going up and down with the economy, and if our surgeons' prices change, we have to adjust our prices. So when we give you a quote, just take into that book, lock in that price, put that deposit down, so you can. So it's not when you come back in 6 months and then you're surprised that it went up $500 or $1,000. I highly suggest you do that.
Alrighty, so I think that's it.
Bye.
All right, bye, you guys.
Thank you. Bye.